Hi everyone, this is Journal 1 for MN669. Um, the first question that I'm going to answer is describe your clinical experience in mental health throughout the psychiatric mental health nurse practitioner program. I will say that I have done outpatient and then also I've done inpatient in the hospital setting, not a psychiatric mental health hospital, but just a regular inpatient hospital, doing clinical rounds and consults for patients that are either on the mental health unit or on the regular medical unit as well. Okay, so the next question are what are your reasons that you have chosen to work with this population? So typically, I've seen with doing the clinicals, adults, geriatrics have been the main population during this clinical time. Typically, were the patients that my preceptor, when I was following her, would see. But also, there were times where we did see pediatric patients during certain days of the week. She had, I think it was like 15 to 20 pediatric patients. So that was pretty cool just seeing how the patient populations varied, the issues that normal pediatric patients would face, and what types of treatment plans was pretty interesting. Um, Overall, I like both. I do like the adult population as well as the pediatric and adolescent population. I haven't really honed in on which one I prefer better, but I do like treating both. It says to discuss any concerns that I might have regarding this specific clinical course and working with the lifespan population for the psychiatric mental health care. I don't really have any concerns right now at this time. Not saying that I won't later, but as of right now, I don't have any concerns. And then it says to identify any of my personal and academic professional goals that I have for this course. I would say just to understand the pediatric population better, in a sense of what type of care plans or medication treatments are best for pediatric populations, looking at, treatments that they can do as far as like cognitive behavioral therapy and other resources that can be provided for them to help with their current mental health. And then, do I have any specific goals for this course? Like I said before, to understand the pediatric population better and becoming just well and more well equipped. So if I do decide to go into pediatrics or adolescents, I'll be well equipped and well versed with different treatment plans and how to approach this population best. And then last, what strengths or weaknesses have you identified throughout this program that can be remedied in this final clinical course? I would say strengths. I've discovered that I am a really good listener, and I believe that that's something that you have to be good at with, just with clinicals and understanding the various age populations and just taking in everything that's needed when providing care, because as a psychiatric nurse practitioner student, you're not a floor nurse. You're required to listen, and sometimes listening you can pick up on different traits or issues that maybe the patient hadn't disclosed, and based off of a few keywords that they might have said, it leads you to ask different questions to kind of peel back layers of what type of treatment is needed. I would say that I have definitely increased or developed that skill. So I believe that my listening skills have gotten much better. All right, that's it.